Now, this move comes as Singapore is seeing recent highs in daily case numbers, with yesterday's figure marking a new record. 26,032 new COVID-19 cases reported last night. Apart from 301 imported infections, the rest were local. And among those, the vast majority, over 22,600, were detected through ART, which means the patients displayed mild or no symptoms. Almost 3,100 were detected through PCR tests. Earlier, I caught up with Associate Professor Alex Cook, the Vice Dean of Research at NUS's Saw Swee Hock School of Public Health. I asked him whether 2 days of record daily cases were a coincidence or something else.
We get consistent differences on different days of the week throughout the pandemic. It's something that we've seen earlier in the Delta wave, for example, as well. It's also something that we see with other infectious diseases like influenza, diarrhea, etc. You can imagine why that if you're feeling unwell on a Saturday night, then you might tahan until the Monday because your regular clinic might be closed on the Sunday, for example. So we'll end up then seeing more people going to the clinic at the start of the week, and then those that test positive in the PCR, they're only going to get the results on the Tuesday. So that would tend to lead to a spike on the Tuesday the next day. For endemic illnesses, so things like influenza, etc., then we'll often see fewer consultations towards the end of the week because fewer people need to get an MC to get off work or off school. And it may be that something similar is at play with COVID as well. And that might be one reason why we see that kind of a sawtooth pattern in a number of cases across the course of the week. That's one of the reasons why I think it's important that we don't get invested too much in the daily fluctuations, but rather that we look at these weekly trends. And so when we do that, we look at yesterday's case counts. It represented about a 30 to 40% growth compared to the Tuesday of last week. And actually that suggests that it's possibly a slight leveling off that could possibly indicate that the peak is near.
So talking about, you mentioned the peak, right? So with 26,032 cases reported yesterday, how significant is this spike? And based on your modeling, is this the peak we've been waiting for?
Well, I guess we've got two lenses that we can use to try to interpret the numbers. And one of them is modeling. So the models that my colleagues and I put together at the start of the year suggested for our middling scenario that perhaps there might actually be about 25,000 cases a day at the peak, with a worst case scenario of around about 40,000 cases. I want to caveat that both of those numbers would represent weekly averages, i.e. they don't account for the Tuesday spike. So even in our middling scenario, we would still expect some growth before we get to the average of 25,000 a day. The other caveat is, of course, these are just models. They don't account for some of the changes in behavior or in testing patterns that we've seen over the last few weeks. The second lens that we can think about is how we can compare how Singapore is to other countries that have already reached peak Omicron. Now, this comparison is not exact because all countries are different, testing rates are different, the level of immunity is different, but it does give us a bit of a gauge for where we are compared to others. So at one extreme, if you look at Denmark, its peak daily cases per million are higher than where we are just now by about 160%, right? And what that means is that between 2 to 3 times as many cases as we are seeing a day is what they saw a few weeks ago when they had their peak. Denmark has very high ascertainment of infections. And so in a sense, Denmark may be like a worst case scenario for us. But if we do follow the Denmark trend, then it would mean that we would reach that level at the current growth rate we're at after a few more weeks, 2 or 3 more weeks. In France, they also peaked at a higher level than what we are seeing just now, by about 80% higher, so almost double. So if we're like France, then it will take us perhaps a fortnight to grow up to that number. Now, at the other extreme, we can look at places like the US or the UK or Germany. They all peaked at a level which is lower than Singapore's current numbers, somewhere between 10 to 30% lower. So if actually Singapore is more like the US or the UK than we are like France or Denmark, then we should have peaked already. And in fact, maybe we did peak yesterday. We don't know. We'll find that out. And like I say, these cross-country comparisons, they're not very exact, but they do suggest that even if we have not peaked yet, we will soon reach peak Omicron.
And Professor, once that happens, we reach the peak, we go into stabilization phase or number or period, what daily numbers should we be expecting then?
Well, the problem with all these day-to-day fluctuations is that they make it tricky to see where exactly the real peak of the epidemic is. And that's why when we're trying to monitor have we peaked or not, actually what I think is the most important value is the weekly growth rate, because it smoothens out things like the Tuesday effect and so on. So the number that I'm going to be focusing on personally when I'm looking at what our current situation is for the next few weeks is going to be that weekly growth rate. Once it dips below 1, that tells us, and it's on a sustained below 1, for not just a one-off day, that tells us that we're on a downward trend that we've all been waiting for. Now, when we come down from that downward trend, then we'll reach a level of something closer to 0 than where we are just now, basically at a point at which there will still be the virus circulating in the community, but that we don't need to worry about it overwhelming our healthcare system.
Well, thank you so much for your perspectives, Professor Alex Cook, Associate Professor Alex Cook from the Swansea School of Public Health at NUS.